Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan. It's a pleasure to be with you hosting this podcast. As I told you in my first 3 episodes, the Healthcare Labyrinth is a new website that is named after my book, The Healthcare Labyrinth, as well. And on the Healthcare Labyrinth website, we have a weekday daily news feed that I publish. We have 2 blogs a week that I also publish, and then 1 podcast a week as well. Those are all available at healthcarelabyrinth.com. And of course, the podcasts are available on leading podcast applications. So let's get right to the topic of this week. It's called The Year in Review, as well as my predictions for 2024. So let's get a little bit into what we saw in 2023 for healthcare. So one important point about 2023 was it really was a continuing year of recovery from the COVID pandemic. As everyone knows, the pandemic basically started in early 2020. It sort of lasted through a portion of 2022. And we really saw very low utilization in healthcare overall, and fairly modest inflationary increases during the pandemic. Well, in 2022 and into 2023, we started to see healthcare utilization move up again, and costs and inflation really have begun to return to normal. So 2023 was part of that recovery on utilization and cost and inflation. Another important major occurrence in 2023 was the fact that we hit a modern record low uninsured rate in the nation. So in the spring of 2023, the government did report that we hit that record low with about 7.7% uninsured, or about, in round numbers, 25 million were uninsured. But I will say that the return of Medicaid redeterminations will probably impact that record low number, and we'll begin to see creeping up again in that uninsured count. But the better uninsured rate, the record low, was really driven by a couple of different factors. Number one, the employer market was actually pretty robust during COVID, despite layoffs. But has really done very well over the last 18 months or so. So, employer group coverage is very stable. We had the Medicaid expansions and the hold on regular eligibility rules, which helped in Medicaid to drive up rosters there. And then, of course, the exchanges have been growing largely because of the premium subsidy enhancements that go through the end of 2025. So all of that came together to give us a record low uninsured rate. It is still well above other developed nations. That averages about 1%, but at 7.7%, we're doing pretty well. But again, we'll talk a little more about the fallout on the return of regular eligibility, known as Medicaid redeterminations, that have begun rolling out in 23. Insurers generally had a fairly stable outlook in 2023, although some financials were a bit mixed, especially because some plans really misstepped in the Medicare Advantage market. And that led to a number of layoffs at some of the major health plans in 23. Hundreds in some cases, thousands in other cases at these leading health plans. I will also note that plans sort of across the board began reacting to a push on Capitol Hill to restrict prior authorizations. We'll talk a little more about that. And they sort of pulled off on hundreds, if not thousands of codes, prior authorization requirements. So these codes with many of the large insurers now are not subject to PA, frankly, because of the trends on Capitol Hill and from CMS, as well as the fact that the administrative cost of prior auths in some of these cases were now exceeding the cost of the service. So it really did not make a lot of financial sense either. This really sort of in 2023 led health plans again across all lines of business to what I call pivot from the nation's obsession with prior authorization to the start of really making care management and engagement with member and providers aimed at reducing costs and improving quality, sort of the framework of the new paradigm for healthcare. We'll always see prior authorizations out there, of course, but there does seem, and it started in 23, we do see a pivot from as a dominant feature of the healthcare system to care management, prevention, wellness, engagement, things like that. On the provider front, hospitals continued to face financial pressures coming out of the COVID pandemic, as do physicians and other providers. As you know, about 50% of all physicians today are owned by hospitals or health systems. Another 20% are also owned by private equity investors. So that trend stalled a bit during the pandemic, but it is recovering, and 2023 was a recovery year for those kind of investments in physician groups. And we will continue to see that kind of thing moving forward as well. Hospitals and other providers lobbied very hard in 2023 for prior auth limitations, as I noted already, as well as not having site neutral payments, which is when the same type of service is paid the same rate, whether it's done at a physician's office, an ambulatory surgery center, or, for example, outpatient hospital. And so those site neutral payments are something that hospitals fear and certain providers fear, and therefore they lobbied a great deal on Capitol Hill against that. And so that was sort of a major feature of what hospitals were focused on: prior auth limitations and no site neutral payments. What seemingly they failed to get, though, were clear and robust rates from Congress and from CMS in the Medicare fee-for-service world, especially. Physicians, again, coming out of 23, are facing a huge cut based on the current formula, and they sort of missed the mark on ensuring in 23 that rates will not go down as of 1/1. Hospitals also saw Capitol Hill criticize health systems for their lack of commitment to charity care. And Congress has actually called for investigation of the vast subsidies that hospitals get through tax-exempt status, really at all levels of government, and why oftentimes hospitals are so stingy on charity care and actually are suing individuals that can't afford their hospital bills if they are uninsured. So I expect that we'll continue to see those kind of investigations and criticisms of hospitals. We also saw another major trend on the provider front where retail establishments, grocery stores, pharmacy, things like that, as well as other healthcare firms, payers, for example, have made major investments in primary care. At the same time, a few entities probably overinvested and they pulled back, but what we call is retail meets healthcare was a pretty dominant theme in 2023 as well. On the bankruptcy front in healthcare, despite the recovery that was going on, we did see very high bankruptcies in healthcare this year. This was especially the case in digital health and some other technology investments, which really led to a major contraction in the private equity and other investment markets. And this was driven in part by some very notable failures in 23 of major tech firms. One of the biggest ones I would note is Olive. Olive was once the darling of investors and was a major AI play in the healthcare world, but it could not essentially gain enough traction. It initially in 23 sort of shut down its provider approaches to AI and was going to focus on payer, but by the end of the year, Olive sort of went out of business, even in terms of payer artificial intelligence as well. Value-based care, which can be payments or arrangements with providers among health insurers, continued to increase in the fee-for-service world as well as in the managed care world. So another good trend there. The No Surprises Act, which was passed a few years ago, continued its bumpy implementation in the commercial world. So we saw huge arbitration backlogs, as well as provider lawsuits that led to a number of suspension in processing. While I believe that providers are favored in this process based on what we see from some similar state arbitration, No Surprise Act laws, providers have been fighting no surprises in court, and we still have more to go on that front, but they are looking to drive the balance, if you could even call it that, even more away and gain absolute favor within this arbitration process for No Surprises Act. One of the other major pieces of news was Cigna and Humana toward the end of the year looked like they might merge. It actually looked like a match made in heaven. Cigna is a very large commercial insurer. It is struggling with their Medicare business, and it actually got out of Medicaid. Humana had a very small commercial business that they said they were going to shed anyway, and they are one of the dominant players in Medicare Advantage and is growing its Medicaid and having great success there. So it looked like a match made in heaven, but just a few weeks ago, talks fell through, and at least for now, they are not going to look to merge. At the same time, Cigna said that it was still looking at selling its Medicare Advantage business, again, because it doesn't do so well in there. And they may be focusing more on the commercial world as well as with their service business called Evernorth. So that's sort of what happened to the Cigna and Humana merger talks in 2023. The insurtechs, which were all the rage for the past 5 years or so, really had sort of mixed news, good and bad. There were some insurtechs that continued to perform pretty well, while others actually in 2023 blew up, and some of them just ceased operations. So good news, bad news on the insurtech front. Let's talk a little bit of politics here before we get into Medicare Advantage, Medicaid, and the Affordable Care Act. Well, on the political front, there were several weeks in 2023 where the U.S. House of Representatives basically shut down when Speaker Kevin McCarthy was ousted in what I call a right-wing putsch. To gain the speakership, McCarthy had agreed to a provision that allowed even one member of his caucus to basically file a motion and call for in essence, a vote of confidence in the speaker or to oust him. And so that actually happened. It came back to haunt Kevin McCarthy. But after that ouster, there were weeks where there was no permanent leader of the House, and that sort of ground any legislative initiatives on Capitol Hill to a halt. The Senate couldn't really pass things. They couldn't reconcile with the House. And it was a great moment of, consternation and things like that in Washington, D.C. Eventually, a new speaker was approved by the Republicans, and his name is Mike Johnson, a Republican from Louisiana. He actually hails from the right wing that ousted McCarthy. But again, that drama just destabilized Washington profoundly. Eventually, some continuing resolutions were passed to keep government open. But by and large, most legislation did not pass in 2023 and has been moved in the second year of the current Congress. More importantly, those continuing resolutions essentially expire in early 2024. One set about middle of January, the other set in February. So all attention will be on in early 24 on that issue. And consequently, the legislative agenda really was upended in 2023 for the most part. Last in sort of the general area, I would tell you, is Humana CEO Bruce Broussard announced that he will be stepping down as CEO of Humana in the second half of 2024. Usually these kind of transitions are fairly long, but he was clearly a very brilliant executive that built up Humana to be one of the best MA-focused insurers in America. And so that's a big change for Humana coming up. Let's talk a little bit about Medicare Advantage here. Number one, early in 24, there was a story or a study, probably a better way of putting it, that sort of basically concluded that for the last decade and a half or so, Medicare spending was much lower than forecast, and people were talking about perhaps Medicare not being in as much trouble as we think it is. And generally, as goes Medicare, sort of goes healthcare costs and spending in general. Well, the truth is that this story was a bit of a bombshell. Nobody expected to see it. But the study really can be tied back to a couple of different things. Number one, it related a bit to bad estimation on the part of forecasters. Forecasters, whether in Congress or outside of government, tend to hedge their bets a little. And we sort of found that those estimations into the out years were just off. They were just too high. There also was admittedly some lower per member costs due to the advent of certain technology advancements that sort of helped keep some disease state costs down. So the two of them really led to the forecast being off for the last 15 years or so. But I do want to note about this story, it does not change the fundamental fact that costs are out of control in America and healthcare in general. And more importantly, Medicare is not terribly solvent. The Part A trust fund is still slated for insolvency somewhere in the early 2030s. And based on just general high spending increases, COVID pandemic being an exception, and aging numbers, we will continue to see the percentage of our gross domestic product dedicated to healthcare costs increase along the way. And we will be spending much, much more dollars over the next decade and two in healthcare. And it will still be enormously out of control. So back to Medicare Advantage here. So early in 2023, we saw Medicare Advantage plans grow, but at their lowest numbers and percentage levels in the past several years. In the early part of this decade, growth was just amazingly robust, but it is starting to come down. And 2023 was the first signal of that. And again, we will continue to see more limited growth moving forward. At the same time, MA did reach its magic number of enrolling 50%, the majority of all Medicare beneficiaries. And that is something that happened earlier than forecast and is rather a significant achievement. So today, more people are enrolled in private managed care, Medicare Advantage, because of the value it brings than in the, what I call the dilapidated fee-for-service system that is the traditional program. Another enrollment bright spot beyond the 50% was the continued rapid growth of special needs plans, especially dual eligible special needs plans. In general, special needs plans, these dual eligible ones, focus on integrating Medicare and Medicaid, and it's a big, big play for CMS. They really want to see this happen. The program has sort of matured over time, and so these SNPs are growing very, very well compared to the overall MA enrollment growth in general. MA plans continued to face much greater scrutiny in 2023. And I believe that this will begin to impact the value and success of MA over time. So in 2024, a new rule will take effect. It was sort of finalized in 2023. And this will vastly limit the use of evidence-based criteria in utilization management and prior authorization moving forward. This, I think, is a tragically bad idea. It comes from a massive lobbying campaign from hospital groups and the AMA and other provider groups over the past couple of years. It is going to be have a deleterious effect on MA, and I think on the entire system, because it basically forces managed care plans to use the traditional programs coverage criteria known as NCDs and LCDs when they're making decisions. They can't largely use outside criteria, and that will lead to much greater costs. That will lead to higher medical expense, and over time, it very well could erode the value in the program and the supplemental benefits, the dollars that are freed up by traditional PA in the program to provide a whole bunch of other benefits that seniors and the disabled need. So that was a very bad thing, I believe, that was finalized in 2023 and becomes effective on January 1st. Next, they also released a draft of the 2025 rule, and there are a number of different things in there too, including new network requirements, much greater agent and marketing oversight, and also reform of supplemental benefits, more transparency related to what benefits are in plans, notifying members, as well as justifying how some of these supplemental benefits adds demonstrably to health outcomes. So these were important regulatory changes we saw there too. On the rate front, we saw an absolute softening of MA rate increases. So over the past couple of years, we saw very, very robust Medicare Advantage rate increases. But the one for 2024 announced in 23 was very modest. It was a modest base increase. But if you look at a new phase-in of a very controversial risk adjustment change that CMS announced in 2023 too, you actually saw a drop in overall revenue, not counting risk scores and things like that. Still in all, it would appear that based on the previous increases that were out there and some creativity by insurers, benefit offerings in MA remain pretty stable for 2024 when they were announced in October, and they actually grew somewhat in certain areas. So overall, the system is still working pretty well. But some clouds on the horizon here, right? The risk adjustment data validation rule was finalized. And if that rolls out over the next couple of years, that will mean huge recoupments for poor risk adjustment practices. So that is a major issue. Humana immediately, and I think justifiably, challenged the rule in court on a number of different grounds, including its retroactive nature. There's no sort of reconciliation between fee-for-service and a Medicare Advantage and some other grounds. So that was filed by Humana in 2023, right after the RADV rule as we know it was finalized. and that will probably work through court in 2024. But that exposure that it creates in and of itself is sort of huge coming out of 2023. There were also requests by Capitol Hill and others to have the Health and Human Services Office of Inspector General to open up a series of investigations in both Medicare Advantage and Medicaid managed care. In addition, Capitol Hill and other groups are focusing in on alleged MA overpayments. That activity has grown a bit and was fairly significant in 2023. Some studies indicated that there were clearly overpayments, but they appeared relatively small, a few percentage points, while some other studies, which I just believe are concocted, had some ridiculous numbers about overpayments by supposedly including alleged beneficial selection in the program and just throwing as much as they could against the wall on overpayments. So, but there were big headlines related to overpayments throughout all of 2023. So this will clearly create a big focus on Capitol Hill moving forward. Late in the year, related to investigations, was a request also to have the HHS OIG look at perceived gaming of what is known as the minimum medical loss ratio rule. And what lawmakers were asking, led by Senator Warren from Massachusetts, was to take a look at whether plans are using their related parties to, in effect, inflate costs to not have to pay back a rebate through the minimum medical loss ratio. These rebates, depending on the line of business, go to members or go to employer groups, or even go to state and federal regulators like state Medicaid agencies and CMS. So that is another thing that was requested and could gain some momentum in 2024 as well. The last point I'd make on MA is that MA plans really continued to have very poor star rating outcomes. This was seen in 2022. It was essentially sort of added to in 2023. And the industry saw an overall major decline in performance from what I think of as the pre-pandemic ratings. I don't really look at a surge in ratings during the pandemic because there was a moratorium put on calculating certain measures. But if you look at pre-pandemic, say 2019 to 22 and 23, we saw major erosion in the number of plans that were contracts that qualified for 4-star and above. The number of people in 4-star and above plans was not materially impacted, but overall, it really does clearly show that MA plans are struggling with driving outcomes. Some of this is related to a series of more complex clinical measures that plans don't do terribly well on. There's some enhanced weighting on member satisfaction that impacted plans as well as the removal of performance outliers through the inclusion of this 2-key adjustment. And that also helped lead to a decline in scoring and bonuses too. Just 42% of MA contracts are now rated 4 or greater. So that's pretty significant. And the number of beneficiaries in 4-star or greater plans actually declined from 77% in 2021 to a projected 74% in 2024. Let's look at Medicaid real quickly here. What were some of the news in 2023 on Medicaid? Well, I referred to part of that when I talked about the uninsured. We did register a record low uninsured rate, but in April, redeterminations in Medicaid where eligibility rules came back in after the withhold of those rules during the pandemic. And so a great number of people have been disenrolled from Medicaid. The projections are that up to 15 million would be removed. Already we've hit 12 to 13 million, so that 15 million number overall may be very conservative. Some people may gain eligibility back later. Many people have been disenrolled from Medicaid on procedural grounds, which are really unfortunate because the federal and state governments don't have a good system of notifying people and have technology systems that talk to each other and things like that. So we will see Medicaid rolls drop because of Medicaid redeterminations. And unfortunately, not everybody will make it to employer coverage or exchange coverage or children's health insurance coverage to remain covered. And that's why we'll see the uninsured rate increase again. Some good news on Medicaid expansion front is that North Carolina passed a law to expand Medicaid, and they will be expanding Medicaid in their state under the ACA. Georgia actually won a lawsuit in court against the Biden administration's pullback of a Trump era waiver that would allow them to expand to 100% of FPL below the ACA standard, but also have work requirements. So Georgia filed a lawsuit against CMS saying that they can't arbitrarily go back and end a previously approved waiver. Judge agreed, so Georgia got the ability to essentially implement that waiver. So that was interesting as well in 23. And so let's just talk a little bit about some other issues in Medicaid. So number one, a number of waivers were approved that essentially begin to allow the Medicaid program to spend dollars and get reimbursed from the federal government on social needs and socioeconomic barriers. This sort of started with the CalAIM initiative in California, but there are now a number of states that have gotten these waivers, a lot of them in 2023, and it really seems to be all the craze. A number of states also expanded continuous eligibility and things like that. And so that was sort of positive news on the Medicaid coverage front, but it was sort of overshadowed by the beginning of Medicaid determinations again in April, which now, again, I said it's about 12 to 13 million people. I think the most recent number in my head now is about 13.4 million people have been disenrolled. Let's go down to the ACA exchanges here. So big news in the ACA exchanges as well. The exchanges saw record enrollment to over 16.3 million lives in 2023, driven by that premium subsidy expansion and some liberalized marketing and open enrollment rules by the Biden administration. A federal judge ruled in a lawsuit that the preventative benefits mandate, which is zero cost sharing, was unconstitutional. But a temporary deal was agreed to with the appellate court that allows the services to continue free of charge while the appeals court will now determine preventative benefits as fate along the way. The plaintiffs in that deal do not have to furnish preventative benefits because of the earlier federal district court ruling. Also, interestingly, late in 2023, former president and now candidate Donald Trump again beat the drum for the repeal of the ACA. This led many GOP lawmakers to complain that Trump was putting them in a bind on an issue that hurt them at the polls earlier. They sought to dampen expectations, but Trump came out in another tweet, essentially repeating the fact that he wants to repeal the ACA and come up with an alternative. He never really has come up with an alternative. Ron DeSantis did something very similar just after Trump, calling for the repeal of the ACA. Let's end with a few other areas here. So antitrust activities. We saw mergers and acquisitions of largely hospitals and provider groups recover a bit in 2023. It's not at the pre-pandemic level yet, though, but it did recover. But the Biden administration has made healthcare antitrust and competitiveness a major issue for the administration. It finalized new guidelines in 2023 that will be used to scrutinize healthcare mergers and acquisitions and potentially stop them. So, that recovery in 2023 may continue in 24, but it may not, depending on these new guidelines about mergers and acquisitions in the healthcare world. Congressional administration activities also centered on the acquisition of healthcare entities by private equity firms. There's a number of things that say they impact study quality, especially if it involves a hospital. So that's an interesting turn of events in 2023 as well. The focus on private equity investments in healthcare and the impact on quality. AI and digital health and interoperability saw a lot of activity. As we told you, Olive went out of business. Some tech firms contracted, but overall insurers seem to remain very upbeat on the use of AI in digital health. Providers were attacking health insurers about their use of AI to deny claims and prior authorizations without adequate clinical review. But insurers also touted some positive use of AI on the prior auth front, as well as on care management. So new regulations that were outlined by the Biden administration sort of lay out what they talk of as prudent use of AI in healthcare to foster better outcomes. And various interoperability rules were also finalized, which should begin, the major adoption over the next several years of interoperability between payers and providers and payers and payers. Price transparency and site neutral payments. So there was a big bullseye on the back of PBMs, and the House managed to pass a bill that created more transparency for PBMs, including banning spread pricing, which is a major problem for health plans and pharmacies. As well, that same bill that the House passed would also implement so-called site-neutral payments for Medicare Part B drug administration in the fee-for-service traditional program. The Senate has not acted on the bill because of all the problems on Capitol Hill in 2023, but we may see both price transparency, PBM reform, and site-neutral payments get passed in 2024 because of the momentum created in the House in 2023. And lastly, the world of drugs here, major news here. We talked a little bit about PBMs and the bullseye on their back and spread pricing. Well, there are a number of upstart PBMs that have a transparency model that they are beginning to gain traction. That led traditional PBMs to actually adopt more transparent approaches as well. And then we had other entities like Mark Cuban's Cost Plus Drugs also delve into going beyond low-cost generics and trying to get cheaper biosimilars to get traction in the market. So I think we'll see a lot from Mark Cuban and other people that have tried to bypass the traditional drug channel model and go direct to consumer, so to speak. Blue Shield of California also announced a major initiative to abandon their traditional PBM approaches to drug spend and create a best-in-class transparency approach with a number of partners. We'll see how that rolls out over the next couple of years. Given major criticism and the potential to pass a bill on commercial insulin prices, many drug makers announced a reduction in insulin prices, and PBMs also used formulary placement to save consumers more money as well. Let's talk a little bit about the Inflation Reduction Act's Medicare drug price negotiations. It saw major activities in 2023. The first 10 drugs subject to negotiation in 26 were announced. All 10 of those drugs makers said that they would participate in the process. They almost had to because they may not win in court with their lawsuit against the act. There's also the quarterly rebate law that continued to show major impact. Drug makers are not allowed to increase drug costs beyond a certain inflation amount, or they pay rebates and penalties. Those rebates and penalties go to Medicare, but they also save seniors and the disabled thousands of dollars per year due to that rebate law. There are other changes that went effect into 2023 under the IRA, including a cap of $35 per month on insulin costs for Medicare enrollees. There was a very important study that came out that basically found what I've often said and what other studies have found, that innovation impacts will be very modest due to the passage of the IRA's Medicare drug price negotiations. The study basically found that drug makers were not really making decisions, at least at this point, on drug investment and innovation based on the IRA. Other market forces were dictating that, but not the IRA. So it was a very, very important study that came out this year as well. The Biden administration also came out with the idea of seizing a drug patent if the drug received major federal funding for development and the drug remained very highly priced. So that's very controversial, but it does show you what the Biden administration is trying to do on the Medicare and overall drug fronts. Biosimilars continued to only see partial uptake in 2023, and that was very disappointing to many because many of the brand drugs that are parallel to the biosimilars are extremely expensive. So Congress focused a great deal in this area. And as I indicated, groups like Mark Cuban's Cost Plus Drug is also now trying to get into this biosimilar area to try and bring costs down. There was also a new Alzheimer's drug that was approved after the Aduhelm debacle that many of you may remember. Let's now turn to some of my predictions. I'll keep this a little bit short. Again, you can read a blog I did on predictions on the healthcarelabyrinth.com by pressing the blog tab. I report in that blog where I'm channeling Nostradamus, my 2023 prediction report card. I think I did reasonably well. You can read about it there. Let's get into my 2024 crystal ball, though. Just in general, overall, as I said in 23, I think 24 will be a stabilization and sort of a return to pre-pandemic levels. On healthcare utilization, I think we'll continue to see that be the case. I think we will have moderate but still healthy inflation that occurs in the healthcare industry. Health plans will overall be stable. They will continue to focus their attention on a lot of administrative and medical expense reductions. I do think some of them will have problems on the MA front, largely because of their star performance and a tighter rate process. But in general, health insurers will be stable. Because of that focus on administrative and medical expense, you will probably see additional layoffs in the health plan world in 2024. In terms of coverage and the uninsured rate, I project that the uninsured rate will increase rather dramatically from the 7.7 reported in 2023, or about 25 million. It will go up by several million. Medicaid enrollment will go down substantially because of the redeterminations. We will continue to see the exchange go up. I think we will see 19 to 20 million enrollees in the exchange. But overall, the uninsured rate will go up because of the major displacement in Medicaid. From a regulatory picture, really across the board, I think you will see scrutiny in several areas. Number one, on the minimum medical loss ratio across all lines of business, I think you'll see Congress and regulators looking at that. I think you will see CMS and even Congress really scrutinize the new prior authorization rules in Medicare Advantage, really at the behest of providers. I think AI will also face scrutiny in terms of its use for claim denials, as well as in prior authorization to some degree. I think you will see in Congress a significant, what I'm going to call transparency reform bill pass at some point in 2024. This will impact providers, health plans, as well as PBMs. So you will see more rigorous price reporting that will impact providers, hospitals largely, health plans, and PBMs. You will see also in the PBM world the ban on spread pricing and probably a few other reforms that the House and Senate will agree to. And you will also see the baby steps toward Medicare site neutrality payments. And that will probably only come on Part B drug administration, but nonetheless, it will start, and it will be a major defeat for the hospital industry. On the antitrust front, I think you will see a lot of antitrust activity with the Biden administration, looking at mergers and acquisitions for both health plans and providers because of the new guidance. And I think that will stymie some of the expected growth in the provider world in terms of mergers and acquisitions of hospitals, and even private equity firms purchasing more physician practices. Let's talk a little bit about Medicare Advantage. So number one, I think it will be very difficult for plans in total to increase membership beyond the rough 6% from 2023. It could be lower. I think it's possible that as Congress begins to try and address budget issues, you could see some rate or other issues in Medicare Advantage, the perceived overpayments, be used for some savings. That's despite the popularity of MA in Congress. I think rates in 2025 will be announced in 2024, and they will once again be very tight, largely because of the phase-in of the new risk adjustment. I think plans will continue to have major issues with STAR, and that will lead to additional losses of ratings and bonus payments to health plans in the MA world. And I think the audit protocol will get much stricter, especially because of the new PA rules that come into place on 1/1. On the litigation front, let's talk about a few things here. So I see three major cases that will be decided in some form. So number one, the Humana RADV risk adjustment case, I believe will be in Humana's favor. At least a portion of that RADV rule will be set aside, and CMS will have to go back to the drawing board a little bit. Number two, on preventative services in the ACA, despite the fact that the appellate court agreed to stay implementation of the lower court's ruling that the preventative services mandate was unconstitutional, I believe the appellate court will side with the federal district court, ultimately rule that at least portions of it is unconstitutional. And I think the Supreme Court will have to jump into it here. And lastly, on the IRA, the Inflation Reduction Act, the Medicare drug prices, I believe that business groups and brand drug makers that have placed lawsuits will lose. I think CMS will win those lawsuits and the IRA will continue to move forward, although I think the drug makers and business groups will appeal all the way to the Supreme Court, perhaps. Let's talk government shutdown. While I don't think this is a good thing for America, I do believe that there is a distinct likelihood of a government shutdown, at least for a period of time. This really stems from Speaker Mike Johnson's political predicament that if he agrees to anything that looks too Democrat or a temporary CR again, his job could be in jeopardy, much as what has occurred with Kevin McCarthy. And number two, he's pretty much staked out a position that he wants a CR that goes through the entire year. He wants at least level funding, if not reduced spending. And I don't think the Democrats are going to be able in the House or in the Senate to get on board for that immediately. So there, I believe, is a likelihood that there will at least be an initial government shutdown for several weeks. Lastly, Ron DeSantis and Donald Trump have called for the repeal of the ACA again. It's my prediction that neither of them will meet their commitment to produce anything that remotely looks like a credible alternative to the Affordable Care Act, which they want to repeal. I think their proposals, if they even make them, will be a mishmash of previous policies that were found to increase the uninsured rate, not reduce it. And I have a hard time thinking that there would be cost savings in their proposals as well. So with that, I hope you enjoyed this recap of 2023 and some of my predictions for 2024. We'll see you on the next Healthcare Labyrinth podcast. Take care.